Hello, my friends. This is Dr. B, the best doctor in medicine. 30 plus years of experience in medicine. And he knows it all, Dr. B. Today, guys, I need to talk to you about something very important. And that is the reason why you, whether you're a man or a woman, after the age of 45, you need to once a month finger your own rectum once a month, right? And this is the topic of the video today. Very, very, very important topic. And I'm going to explain to you why once a month, guys. It's not too much to ask. You need to spend maybe 5 minutes, 10 minutes to finger your own rectum, your own butthole, your rectum deep inside. And I'm telling you why. Guys, Dr. B is not here to make any money, to sell you any fake stuff, to BS you with long lectures about medicine. Dr. B, 50 years young, super healthy, is here to give you healthy tips so that, like Dr. B, you can age gracefully and stay away from cardiovascular diseases, chronic diseases, dementia, cancers, blah, 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 millions, thousands of diseases that with the help of Dr. B, you can stay away and just like Dr. B, age gracefully to, God willing, be 100 years old and hopefully stay away from these nasty diseases, right? Guys, remember that cancers are the second killers of mankind. The number one most common reason why humans on earth die is cardiovascular disease, right? Heart attack, right? Heart attack kills millions of people every year all over the globe, right? Then comes number two, cancers. Cancers are the second killer of mankind, right? Millions and millions and millions of people die every year of cancer, right? Among all these cancers that kill humans like fleas, right? Millions of them dying every year of cancer. The second cancer killer, second one, is the colorectal cancer, right? The cancer of the large intestine and the rectum. And I give you a lecture separately about colorectal cancer in another video. You can watch it. And the 3 tips that I gave you about how to stay away and lower your risk of colorectal cancer. The second cancer in mankind, cancer killer in mankind. Remember, the number one is, of course, number one cancer killer is lung cancer, right? Whether you're a woman or a man, it doesn't matter, or anything in between, it doesn't matter. The number one cancer killer is lung cancer. And whether you're a man or a woman, it doesn't matter, or anything in between, regardless of your gender, age, blah, 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 blah. I apologize, not age, but regardless of your gender, sexual orientation, blah, blah, blah. The number two killer of mankind, regardless of your gender, man or woman or anything in between, is colorectal cancer, the cancer of the large intestine and the rectum. Remember, when you eat food goes into your stomach. From there, it goes into your small intestine, your small gut, right? The small intestine allows digestion of the food that you ate and also absorption of the nutrients, right? In addition to the stomach, right? Digestion starts in your mouth, then the food goes into your stomach. Over there, digestion starts, absorption of nutrients starts, but most of it is performed in the small intestine. Once the food has been digested and all the nutrients and healthy stuff absorbed, it goes into your colon, your large intestines, and it becomes poop, right? The fluid is absorbed in your large intestines, right? And it becomes poop. And then from your large intestine, your colon, it goes to get stored in the very last part of your intestine that we call the rectum. And the rectum has an opening that we call the anus, right? The anus, the butthole, right? The anus is going to open and you're going to defecate, right? To eliminate these fecal matters that have been accumulating in your rectum, right? 20%, 17 to 20% of all the colorectal cancers, second killer of mankind, right? Second cancer killer of mankind, right? Colorectal cancer occur in this rectum, the rectum, right? Which is the last part of your large intestine that stores the stool before you defecate, before you poop, before you exonerate, right? Exoneration, defecations, or the defecation are the medical terms to say to poop, right? To take a crap, right? Whatever you want to call it. Who gives a cazzo? You get what I mean. So this rectum that gets full of fecal matters, right? 20%, 17 to 20% of colorectal cancers occur there, right there. Now, as you know very well, and I told you in another video, right, the incidence, the rate of new cases, the number of new cases of colorectal cancer is increasing every year in Western civilization, in modern Western countries, like Europe, Canada, Australia, blah, blah, and everywhere else. For the last many 2 or 3 decades, epidemiologists have noticed that younger people, 45, right, 50, 49, 55, start to develop at younger age, right, this freaking colorectal cancer, right? Younger people. And of course, I gave you another video. Please look at it. The reason is, of course, all this junk food, ultra processed food, right, that people eat nowadays. Not enough nutrients in their food, healthy nutrients, not enough fibers, right, healthy fibers, and of course, not enough healthy gut microbiota, right? The microbiota, these healthy microbes that are in your colon, protect you against getting colorectal cancer, right? The second cancer killer. Eating enough fibers, healthy fibers, right? Protect you from getting this colorectal cancer, right? And of course, staying away, just like Dr. B, from any processed or ultra-processed food will keep you away from colorectal cancer, right? Dr. B never eats freaking processed food and ultra-processed food, right? No freaking red meat, all this nasty shit that they sell people that is ultra-processed, and all these freaking burgers and fries and freaking pizzas and everything. Stay away from that garbage, right? Now, once you understand that the rate of colorectal cancer is increasing regularly every year in America, Canada, Australia, Switzerland, Europe, France, anywhere, right? And then once you understand that 20% of these colorectal cancers occur in the rectum, the last part of your intestine, right? Then you understand what Dr. B means by fingering your own rectum once a month, right? Once a month as a screening examination that you do yourself. Guys, try to understand something. Whether you are a man or a woman, when you go to see your family doctor or your internist, right? Or when you are a woman and you see your gynecologist, right? The gynecologist doesn't finger your rectum to screen you for rectal cancer, right? Rectal cancer, the cancer of the rectum, 20% of all colorectal cancers, right? She just doesn't. She does a pap smear, she puts a little speculum to look inside your vagina, to look at your cervix, to look at the wall of your vagina. She does the pap smear to screen you for cervical cancer, right? Every once in a while, she's going to do an ultrasound to screen you for endometrial cancer, to screen you for ovarian cancer. She's going to palpate your boobs, right? To check you for breast cancer, right? But she's going to tell you, remember to do breast self-examination every month. Every month a woman has to palpate her own boob, stay in front of the mirror, look for asymmetry, little bumps and lumps and blah, 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 right? When men go to see their family doctor, right? The family doctor, after a certain age, usually 55 to 69 years of age, is going to finger you who has a prostate, to check you for prostate cancer. But your doctor, your family doctor, is not going to finger your butt to screen for rectal cancer, right? Because that requires that he goes deeper, right, higher. And it requires that your rectum be cleansed of all the poo-poo, the fecal matters, right? So he's just not going to do it for these reasons. And he's in a rush. He has to see 30, 40, 50 patients a day because he wants to make a lot of money, pay the bills, his staff, the rent of his clinic, his overhead, and blah, blah, blah. And those doctors who are at the hospitals are the same. They are forced by the hospital to see a lot of patients to justify all the money that the hospital pays them. So they are forced to see a lot of patients. So when you are a certain age, even if your family doctor or your urologist puts a finger in the butt after a certain age, they're going to check you only for prostate cancer. And the prostate is very close to your butthole. You don't need to go deep. You just go couple of inches, right? It is about couple of inches on my finger, right? Do you see it? Couple of inches, right? 5 centimeters. That's it. He's going to ask you to bend over, right? Put your finger in your butt. Okay, your prostate seems pretty good, right? And okay, I'm going to give you this blood test called the PSA. You're done. Get out of here, right? He's not going to take his time to go deeper in your rectum to check all the walls of your rectum to make sure that they are nice and smooth, that there are no lumps and bumps and blah, blah, blah. Not only because he doesn't have the time, but also in order to be complete, to do it good, you need to have a rectum that is empty, right? So you need to have cleansed your own rectum in order for your doctor to put a finger deep into your butt and be able to look at your rectum, to feel your rectum, blah, blah, blah. Make sure that you don't have a tiny little lump that he can feel. Oh my God, look at that. I think you have a lump, a hard little lump. Oh, look at that. There's some blood coming out on the glove. I need to send you for a rectoscopy to my colleague gastroenterologist who's going to do a rectoscopy with a rectoscope and look inside your rectum, right? Oh, look at that, you have, and do a biopsy and tell you have a rectal cancer, right? The urologist is not going to do that. He's concentrated on your prostate. Your family doctor is not going to do it. He's also too busy. Even if he puts a finger in your butt, he's concentrating on your prostate, right? And remember that according to the guidelines, your doctor is not going to screen you for prostate cancer until you're 55. So all these people young men and women starting at the age of 40, 45, 50, their family doctor, right, or their gynecologist is never gonna put a finger in their butt, right? Because if you are a 40-year-old man, 45-year-old man, 50-year-old man, 54-year-old man, your family doctor gonna say, you know what, I don't need to put a finger in your butt to check your prostate because you're not eligible for prostate cancer screening. But hey, doctor, what about rectal cancer, which is 20% of colorectal cancers, right? The second cancer killer. Well, I think you're too young. Well, really? But your family doctor, guys, doesn't care that much, right? Your family doctor is under pressure to make money, to pay the bills, to see 30 patients in a day, 40 patients in a day, in and out, in and out, in and out, in and out, from one exam room to the other, right? He's in a hurry because it's almost 4 o'clock to see all these 10 patients that are left before he can go home and relax, right? So he's not going to do it. And he's going to say you're too young and blah, 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 and blah, blah, blah. Right? So there is so much your family doctor is going to do for you. There is so much your internist is going to do for you. And there is so much your gynecologist is going to do for you. Right? So it is the same for skin cancer, right? Your family doctor is not going to screen you for skin cancer, for melanoma. You need to be completely naked. He needs to look at you, the back, the front, your genitalia area and everything, right? He's just not going to do it, right? So you are responsible for looking at your own skin, right? And to look for abnormal skin spots every week, right? Once a week, right? And usually I do it myself also when I come out of the shower, right? So it's important. There are some cancers that your doctor gonna not look for and not gonna care about, right? Skin cancer, your family doctor, your internist are not gonna ask you to get naked. Fully naked you have to be, because he has to check every inch of your skin, right? He's just not gonna do it, right? Because he doesn't care. He doesn't care, right? Exceptionally, maybe you can make an appointment with him because this and that, and he's gonna just check your skin. Okay, and if he finds something, refer you to a dermatologist. But most people, by the time they are referred to a dermatologist, the melanoma has already spread and the skin cancer has already spread to the lymph node, and that's it, and blah, 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 right? So for the rectal cancer of the rectum, which is 17 to 20% of colorectal cancer, you can detect it yourself. You can do your own screen, right? You don't have to wait until you're a certain age so that your doctor makes you eligible for the hemocult, this little test that they put a little reagent into your feces, right? They make you poop and collect a little bit of your poop. You put it in a special container, you put it in a package, you send it to the lab, and the lab's gonna detect blood in your stool, right? And then if it's positive, you're gonna be eligible for a colonoscopy. But they do that to men and women after a certain age, usually 55. Before that, you're not eligible, right? And of course, that screening test for occult blood in your stool, right, is not 100% sensitive, is not 100% specific, right? And you're not going to be eligible for the general screening called colonoscopy until you reach a certain age, right? Most insurance companies are going to delay, they're going to find excuses and blah, 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 right? But at least you, as a man and a woman, the same way you examine yourself, your own skin to look for melanoma and skin cancer, the same way you check your own boob, right? Once a month for women and maybe once a month for men to check for lumps, right? You can easily, once a month, it's not too much to ask, finger yourself, right, deep inside, and screen yourself for rectal cancer, which your doctor is not going to do. It's just not going to happen, right? Now, how do you do that? And this is the next point that I want to make. Make sure it's on a weekend, so you are not rushed by the clock that you need to go to work quickly and blah, 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 right? Make sure it's on a weekend, right? You wake up in the morning or it's in the afternoon, you are not rushed, or in the evening, who cares? First, you poop. And make sure when you poop that you are sitting. You have to always poop in a seated position. And I have another video regarding that. So that your rectum empties itself completely, right? I mean, more than when you are seated. So you need to, did I say sitting? I apologize. You need to poop squatting. I apologize. I take that back. You need to poop squatting, like people in Japan, in those Japanese toilets where you poop when you are squatting. When you poop sitting, like these modern Western toilets, you are not emptying it completely. And I showed you another video how to poop squatting, not sitting. You get a little stool, you put it close to the toilet, you put your feet on top so that you are squatting on the toilet seat, your butt drops into the toilet seat, and you can poop, right? After you have pooped completely, then you have to cleanse your rectum. And I showed you in that video, in another video, how to cleanse your rectum, right? Me, Dr. B, every day I poop twice. And every day after I have pooped, I clean my rectum, my inside, with a little bottle. It's a specifically designed bottle that I put simple water in it, right? And I empty it by squeezing it, right? And I empty it in my rectum, and then everything comes out into the toilet, right? And I do it 2 or 3 times, right? The other option that I told you is that you can ask a plumber to come and install a specifically designed with a little hose and a little handle, right? Like those that you see in Thailand and Japan and China, a little squeezer, and you have water, and it has a little narrow tip like that you can put into your butt, and you push the water inside. It doesn't have to be sterile, right? You push the water, and then you push it out, and you're going to see all this water with fecal matter coming. You will not imagine how much poop will still come out after you thought that you had already emptied your rectum, right? So much poop is still in there, right? Watch the other videos. You will understand a little bit, maybe better, more explanation. So you poop. Make sure you are in squatting position, not sitting. Then make sure you cleanse your rectum. You do an enema, right? But do not use any irritants. Just simple water is enough, right? You can go buy on Walgreens a little plastic enema bottle. It's usually made of saline solution, means salt water. But then for the next time, you don't need to put salt water. Just simple water, clean water from the tap is enough, right? And then you squeeze it 2 or 3 times inside your rectum. That's it. Your rectum now is completely empty, right? No poop, no poop. Then you take your shower. Because it's a weekend, right? You need to take your shower. You just woke up, or it's the afternoon, or it's the evening. You take a nice shower, right? So inside your shower or your bathtub, you need to have water falling all over you, right? And you squat, right? You squat into your shower or in your tub while water is falling all over your body, right? As you squat, you take this finger or this middle finger, it doesn't matter, the one that makes you comfortable, right? Me, I do it with my middle finger, right? I remember I do this every week, but you don't have to do it every week, right? You do it once a month is enough, right? I do it every week because I know now how to do it very, very quickly. It takes me just 30 seconds and I'm done, right? And now, remember, your rectum is cleansed, right? There's no poop, right? And you don't need lubricant to do that. Just the water is enough. You squat in your shower or in your bathtub. You relax your buttocks, right? Your butt muscles. and you relax your anal sphincter, your butthole. You relax it because it's nice and warm. The water is relaxing you. Your muscles are relaxed. Your butthole is relaxed. And you put your finger inside, right? You're going to feel that, you see, you're going to feel that your rectum like that. It's not going to be a hole, right? There's no hole. There's no cavity. It's a virtual cavity because the walls, the rectum is empty. So now the walls are like that. So you're going to put your finger in your butthole and you have your rectum. And what you do, you go all around your rectum. Make sure you go all around, right? You go all around. And then you're going to feel these very smooth walls. And you're going to feel some tiny little folds. Those are normal, right? Little folds because the wall of the rectum, the wall of the last part of your intestine, is not flat like a wall, like the walls of like the wall of your room, right? It's not flat. It has little folds, right? Tiny little folds, like the folds, right? It has tiny little folds, right? Do you understand what I mean? These folds. So you're going to feel these folds. They are very soft. You're going to feel the walls of your rectum nice and very soft, right? Nice and very soft. Make sure you put your finger all over the place. Right, and make sure that you do that. You do that with your finger here, not the back of your finger, right? The pulp of your index or the pulp of your middle finger, right? And you go through that. Make sure you do not use gloves. Don't use any nitrile gloves or any plastic gloves. Your rectum is clean, right? Worst comes to worst, if there's a tiny little bit of poops, well, you are washing yourself with water. You remove your finger and you wash it and you put it back, right? It's your own poop. It's your own rectum, right? So you do not use gloves. The other reason to not use gloves is because when you use nitrile gloves, these exam gloves that you see everywhere in clinics and doctors' offices, they numb your fingers. You don't have this accuracy to detect tiny, tiny little hardenings, right? If there is a tiny little lump, if you wear a glove, you're not going to feel it, right? Because you have all these sensors, right? All these sensors at the tip of your pulp here, at the tip of your fingers, right? Right? The sensory nerves that detect any abnormality, something that is hard, right? It can be a tiny little lump to start, or it can be an average lump or a bigger lump, right? And it can be pretty high. So make sure you don't just put it 2 inches, right? And, oh, okay, I'm done. No. You have to go very deep. And you have to examine all the walls of your rectum, from the front, the back, the sides of your rectum, right? And feel these nice and smooth walls of your rectum, right? And feel these little folds. You can feel them so easily. Believe me, you don't have to be a doctor to do that. It's not like I'm asking you to examine your own prostate. If you know enough about medicine, like anatomy and stuff, and if you're kind of like a medical student, you can start doing your own prostate exam because you start to understand what it is. Examining a prostate and understanding if the prostate is normal or abnormal requires some experience. So the regular person like you, and I love you, the regular person like you, whether you're a male or a female, you can do your own rectal exam, but don't do, if you are a man, don't do your prostate exam because that requires knowledge and clinical experience. But the rectum is just nothing. It's just the last part of your intestine. Once it's empty of poop because you emptied it completely with water, with enema, it's going to be like this, and you put your finger inside, right? Oh, it is like, I would compare that to putting a finger in the vagina of your partner. Let's suppose you're a guy or a woman, and you put your finger in the vagina of your wife or your girlfriend or your female partner, whoever the katsu it is that you have, you're going to feel that the walls are nice and smooth, right? And they have tiny little folds. Those are normal, right? The little folds of the mucosa, of the lining of the vagina. The rectum is exactly the same. The walls are smooth, right? You go all over the place. Try to go the deepest. Me with this finger, I feel more comfortable because I can go, my God, I can go very deep up in my rectum, right? Very deep. And I relax my muscles so I can push my finger very, very high, right? Into my rectum, and I check all the walls and everything. So it's exactly as if you were putting a finger in the vagina of a woman, right? It is exactly the same. If you feel any hardening, any lump, even tiny, right? Or if you have blood coming out, my God, you have to immediately go see your doctor and tell your doctor, listen, I have something, a lump into my rectum. And your doctor will say, oh, really, really? Okay, I'm going to refer you to that gastroenterologist, that GI doctor, who will ask you to come after doing an enema in the morning, and then he will look with a special tool that we call a rectoscope. He will put a tool inside your butt, and he will shed a light, and that will show him that, oh, look at that, there is definitely something wrong. He's going to do a biopsy and blah, blah, blah. But you can avoid all that by screening yourself for rectal cancer, because your urologist not going to do it, your family doctor not going to do it. Even if you ask them to do it, right, he's not going to do it because you're not prepared. Your rectum is full of fecal matters, right? I have tried myself on many patients for many, many, many years to try to do a full, thorough, complete rectal exam without having the patient cleanse his rectum. It is BS. Any doctor who tells you he can do a full, deep, thorough, complete rectal examination, digital rectal examination, screening for rectal cancer without you having before cleanse your rectum, right? He's just BSing you. It's just not going to happen. In order to be thorough, nice, and accurate and detect tiny, tiny little starting cancer in your rectum to give you the highest chance of survival, healthy, and to be cured, right? You have to detect the cancer early, right? And your doctor not going to do that. Your family doctor not going to do that. Your hospitalist doctor not going to do that. Your urologist not going to do that, right? So listen to Dr. B. It is very, very important to take some matter about your health into your own hands, right? The same way that I told you in another video, you need to check your butthole, right? At least once a month, right? You need to sit down, you need to lay down in bed, right? And have light and a mirror, and you need to spread open your butthole, your anus, to make sure that you don't have any anal cancer, right? That your butthole is nice and beautiful with the skin and the folds, and maybe you have some hemorrhoid, but that's okay. But as long as you don't have any lesions, right? You need to not have any abnormality, right? Any ulceration, any bleeding lesions, right? Those can be, of course, anal cancer or anal fissures, blah, blah, blah. Then you need to go see your doctor, right? Because your family doctor or your urologist is not going to check your butthole every month to screen you for anal fissure, to screen you for hemorrhoid, to screen you for anal cancer. They're just not going to do that. They are not interested. They are in a hurry. And so you, my dear fellow citizen, right? I love you, whoever you are. You need to check your own butthole. Start doing it at the age of 40, right? And you need to finger your own rectum the same way I told you. Start at the age of 40. Because, as I said, the number of new cases of rectal and colon cancer, colorectal cancer, is rising and rising and rising, and we see that more and more and more in younger and younger patients less than 50. Whereas it used to be in the elderly, right? The guy is 60, 70, 80, he starts to develop colon cancer. No. Now, because little children are being fed junk food. The kid is just 2 or 3 or 4 years old. He starts with the Happy Meal at McDonald's, pizza, Burger King, junk, garbage food that they feed this little kid. By the time 40 years later, right? Imagine the kid is 2 or 3 or 4 or 5 years old, right? The kid, let's take the example of a 5-year-old kid, right? Mom and dad are busy. They're busy working, paying the bills. They're tired. Mommy doesn't have the time, nor the will or the energy to cook good food at home and to feed her kids, right? So this 5-year-old kid, quickly mommy goes into the drive-in, right, gets burgers and fries. To the kid, nasty junk carcinogens, right? And then at home on weekend, they order a pizza and blah, 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 blah. By the time this 5-year-old kid turns 45, 4 decades have passed. 4 decades of food full of carcinogens, right? Dyes, full of dyes, carcinogens, full of nasty chemicals that nobody knows what the cats so they are, right? There's a list of chemicals like this in every processed food. Nobody knows unless you're a chemist. What is this chemical that they put in that so-called 100% beef? Well, it's not 100% beef. It's full of garbage and chemicals and nasty carcinogens and dyes, right? So after 4 decades, that little kid eating all this nasty shit, right? By the age of 45, guess what? He has a little cancer growing into his rectum, right? But he doesn't know it because it's tiny. And of course, he doesn't look at Dr. B's videos. So he doesn't know that in 5 minutes, he can just go to the restroom, poop, cleanse his rectum, then go into his shower, squat, and finger himself deeply when his rectum is completely clean, and go all around and make sure that he doesn't feel any lumps and bumps. And believe me, you're going to get better and faster at doing it as you do it. Or it's like everything else, right? It's not a rocket science. Believe me, putting a finger in your rectum and checking for a hard lump or for a bleeding. Oh my God, my finger is, how come I put finger in my butt and I'm bleeding? How come? It doesn't require you to be a math genius, right? It's kind of quick and easy. So this 45-year-old guy is starting to develop rectal cancer. By the time he starts to bleed in his poop, and oh my God, look, each time I wipe my butt after pooping, right, there is blood. Let me go talk to my doctor. Oh my God, the family doctor is, oh really? Oh, look at you. I'm going to refer you to this gastroenterologist. By the time the gastroenterologist bring you in, it's going to take you 2 months to make the appointment. By the time everything is checked and he has received the results of your biopsy, my God, look at that. You got rectal cancer. And by the time he does all the imaging and the CT and blah, 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 and refers you to the surgeon to have the surgery, after the surgery, they're going to find out that, my God, the cancer has spread to your lymph nodes and it has spread to your liver. That's it. It's done. You're a stage 4 rectal cancer. Right? It's crazy. Guys, remember that there is so much the healthcare system in America can do for you, right? There is so much your doctor can do for you, because, and it's going to get worse. Not only you're going to have to wait more and more to see a doctor, in addition to that, you're going to see your doctor after waiting for 2 months. You're going to see him in that room for 5 minutes only, blah, blah, blah. The average time a patient spends inside the exam room is 5 to 7 minutes. Statistics of the American Medical Association. And it's going to get even worse. Less screening, less tests, less this, less that, because the country also is bankrupt. We have $37 trillion of national debt, $37 trillion, and it's going to get worse and worse and worse every year. $37 trillion of national health, The healthcare system is bankrupt. We spend almost $4.9 trillion every year, and it's going up on healthcare. Think about that. We spend $4.8 trillion. Trillion, not billions or millions. $1 trillion on healthcare. Despite that, millions of Americans don't get adequate healthcare or screening or treatments or anything. We would need a massive amount of trillions and trillions and trillions of dollars to cover all our population and give them adequate screening and healthcare and blah, 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 right? And believe me, it's not going to happen for all our 335 million people in America, right? America, as of 2025, has 335 million people population, right? In order to provide adequate, good, state-of-the-art healthcare to these 335 million people, right, we would need to spend double the amount of healthcare money that we spend, right? And remember, I told you that we spend $4.9 trillion a year on healthcare. So that's almost $5 trillion. So in order to cover everybody and to give them, because coverage is not enough, right? You cannot give insurance to somebody, but then the guy cannot see a doctor with his healthcare insurance. So having coverage doesn't mean that you have access to healthcare, right? There are millions of people, right, all over America who have insurance coverage, but they don't have access to healthcare, right? For other reasons. I will come up with a video about that. So we would need to spend double the $5 trillion. We would need to spend every year as a country $10 trillion, not billion, not million, $10 trillion in order to provide adequate, good, state-of-the-art therapy, treatment, medication, prevention, blah, blah, access to doctors and surgeons and this and that, eye doctor, eye care, dental care, blah, 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 to $335 trillion. Million people, 335 million people. Think about that. Do you really think we have the money, the $10 trillion it would take to cover everybody and to give good health care and good coverage and blah, 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 good screening to all this population, massive population and growing every year in the United States? No. So it's not going to happen. So you, my fellow citizen, my fellow compatriot, I love you. Whoever the catso you are, it doesn't matter. I'm color blind, gender blind, race blind, blah, blah, blah. I really do love you. You need to be in charge of your own health care. You need to take matters in your own hand. You need to not wait, oh my God, I have my appointment with my family doctor in 8 months, right? No. Because when you're going to see your family doctor for your regular checkup, he's going to do a blood test, check your vitals, blah, blah, blah. He's going to do the regular screening, but he's not going to check you for rectal cancer. He's not going to check your butthole to make sure you don't have anal cancer. He's not going to check your mouth, to make sure you don't have oral cancer. To some extent, your dentist can do that, right? He's not going to, as if you are a woman, unless you go see your gynecologist, the family doctor is not going to do that, right? So you need to take matters in your own hand. You need to make sure that you check yourself with monthly, I would say, even though I do it weekly because I can do it so quickly, so fast, and blah, blah, blah. You're going to get better each time you do it. Once a month, check yourself for rectal cancer. Guys, I will post another video a little bit later, in a few days maybe, about this difference between having healthcare coverage and having access to healthcare, right? I live in Mountain View, California. We have millions of people in California who are insured by the state of California with an insurance that we call Medical. This is Medicaid for people who are below a certain level of income, right? We call that Medical, means Medicaid for California. Millions of Californians, right, do have insurance provided by Medical. The state of California is supposedly giving them this free taxpayer subsidized insurance, right? But most of them, guys, they have no access to health care, right? Because each time they get sick or they want to go for this and that and this and that, the doctors, the hospital don't accept that medical insurance. So they have the medical card, they are covered by the state, but when they want to make an appointment, hello doctor, I want to make an appointment for my regular checkups. Okay, so what's your insurance, ma'am? Well, I have medical. Well, I'm sorry, ma'am, but we don't accept medical. Really? You don't accept medical? How come? Blah 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 blah. Okay, I don't have the time. Get out of here, bam. Right? And then she calls another doctor. Doesn't work. It's crazy. So millions of people, not just in California, but all over the U.S., even if they have coverage, healthcare coverage by state-sponsored, government-sponsored insurance. I mean, look at Medicare. It's the same thing, right? The federally sponsored health insurance. It's the same thing. They don't have access to healthcare because a lot of doctors, clinic, hospitals don't accept Medicare and they don't accept Medicaid. It's a disaster. So be in charge of your own healthcare. Don't wait for your doctor to take care of you, right? You take care of yourself with the help of Dr. B. Guys, I love you. I really do. You make me happy. I swear to God, I feel like the good old days when I was in the classroom teaching medicine and health sciences to my students. You make me happy. This is my classroom. You are my students. Hundreds of you listening to me. Guys, I'm always available. Put your comments or anything you have down there. I will get back to you. It will take time, but I promise I will do it. I love you. I give you a big hug. God bless you for your listenership. I love you all. I really do. Thank you. Bye-bye.